My name is Dr. Ganesh Nagarajan. I am a director of gastrointestinal, liver and pancreatic cancers at the Nanavati Max Institute of Cancer Care in Mumbai. So today we will look at what are the reasons why gastric cancers are diagnosed at such a late stage. What are the signs and symptoms that one should look out for? Who are the patients who are likely to suffer from these cancers? And these are some of the questions we'll answer in this video. So gastric cancer is a fairly common cancer in India. There's a very interesting divide in urban and rural India again. The urban India sees a lot of proximal gastric cancer, meaning cancers of the stomach close to the esophagus. And in rural India, we see more of distal gastric cancers, that means towards the end of the stomach. And this has also probably got to do with certain infections like what is called as H. pylori, which is one of the factors for distal gastric cancers. The urban cancers, the gastroesophageal junction cancers as we call them, or the proximal gastric cancers are more common in the urban population, in obese patients, in patients with bad lifestyles, poor exercise patterns, patients who are obese or have a lot of reflux. Those are the patients who have proximal gastric cancers or GE junction or gastroesophageal junction cancers. So common causes are infections with H. pylori. So if you are suffering from acidity for a very long time and it's not getting okay with regular medications, one should do an endoscopy to check whether there is H. pylori, and that is a common infection in India. And when this is not treated and it persists for a long time, these patients can end up with gastric cancers. Also, I think it's important to have a good lifestyle. It's important to reduce weight. One of the reasons why gastric cancers is picked up late is because we don't, the symptoms are very subtle. Sometimes it's very difficult to pick up. They're chronic symptoms, and people often just associate it with acidity over a long period of time and keep ignoring these symptoms, and till a time when they are actually starting to vomit and they come to us at a very late stage. So any chronic gastric symptoms that are not treated with regular medications must undergo an endoscopy. It's a simple test, but it can pick up these problems at an early stage. By treating H. pylori infections, we can prevent gastric cancers. And you should never ignore weight loss. People often feel happy that they're losing weight, but they don't realize that they've not really taken efforts to lose that weight. It's an unexplained weight loss, and I think those are the ones where one should be aware that they should go and get checked with the doctors. So with these little bit of awareness, I think we'll be able to pick up gastric cancers early and treat them. And if treated early, I think these patients have very, very good outcomes. So the important point is to try and pick up and treat them early. Thank you.